Gratitude to all of you who have worked together with us in the true spirit of coordination and collaboration to make sure that the right information and accurate information and timely information is propagated to all member states. This week is very special for Africa CDC. We are celebrating our 4 years anniversary. Exactly 4 years ago, on January 31st, 2017, the head of state launched the Africa CDC as a specialized technical institution of the African Union. I always characterize the creation and launch of Africa CDC as one of the greatest political innovation that was inspired by the vision and wisdom of our head of state. At that time, Ebola had, the continent had just fought a very fierce battle against Ebola in West Africa, and I'm sure they knew that the future was going to be characterized by other pandemics. So they launched Africa CDC. We are really truly humble, those of us who were called on to be pioneers in setting up the Africa CDC, to that we were given the opportunity to truly contribute, share our experience, our resilience in setting up an organization that was just an idea when they did that famous ribbon cutting at the African Union. So join us, colleagues, in celebrating our 4 years anniversary that has been full of action and impact across the continent. So on that, I would like to come back to the topic of the day, which is the update on COVID-19. As of 9 a.m. East African time, the world has recorded 103 cases of COVID-19, of which 2.2 million people have unfortunately died with a case fatality rate of 2.2%. Now, when this pandemic just started last year, indicating that 1,000 people have died was very troubling. My fear today is that with the large number of deaths that have occurred, this begin to become numbers rather than people. I would like us to continue to remember that these are individuals, they are loved ones, they are sisters, mothers, brothers, uncles, really, and to put a face to these numbers so that they cease from being just statistics. That is my greatest, it will be a tragedy if we begin to normalize these deaths going forward. So that just means to me that we have to redouble our efforts to fight so that no one person dies from COVID going forward. I think it should be a common commitment that we say, I will protect myself, I will do the right thing so that I can protect, deny the virus the space to spread. By doing that, we'll be decreasing mortality. On the continent of Africa, 3.6 million cases of COVID-19 have been reported, representing about 3.5% of the total cases globally. And of that number, 3 million recoveries have occurred, and that is 86% of the total cases that were infected that have recovered. Unfortunately, also in Africa, 93,000 individuals have died from the COVID-19, and leading to a case fatality rate of 2.6%. So again, the global case fatality rate is 2.2%, the continental case fatality rate is 2.6%. That shows you clearly, as I indicated last time, that our case fatality rate is becoming very troubling because it has now exceeded the global total. It used to be the reverse. We used to, during the first wave, the case fatality rate was about 2.2%, and now we are seeing a 2.6%. In terms of the number of countries experiencing the second wave, 41 of them are currently experiencing the second wave on the continent. That is 41 of the 55 member states. 5 countries that are accounting for about 70% of the caseloads include South Africa with 1.4 million cases, or 41%, Morocco 13%, Tunisia 6%, Egypt 5%, and Ethiopia 4%. The number of countries with case fatality rates that are higher than the global total of 2.2% continue to increase. 2 additional countries were added to the list this week, for a total of 20 countries, or 36% of the countries that are experiencing a case fatality rate of more than 2.2%. And I'll just read through them because it's very important. Sahrawi Republic, Sudan, Egypt, Liberia, Mali, Zimbabwe, Eswatini, Comoros, Niger, Chad, Tunisia, Gambia, South Africa, Malawi, DR Congo, Somalia, Algeria, Mauritania, Senegal, and Angola. So when we now look at the last 4 weeks, that is the week between January 25th and 31st of January, we observe that overall we see an increase of 26%. You see that we have recorded 130,000 new cases and 5,600 new deaths reported on the continent. And it represents a 26% decrease in cases and 10% decrease in deaths over the previous week 3 of 2021. Again, a lot of this decrease is because of what we are seeing in South Africa, where there is bending the curve. South Africa again represents 40% of our the pandemic across the continent. The highest proportion of new cases reported for the week was from Southern Africa, that is 54%, followed by Northern Africa 21%, West Africa 16%, East Africa 7%, and Central Africa 2%. 5 countries accounting for the highest number of new cases included South Africa 40,000, Tunisia 11,000, Nigeria 9,000, Zambia 8,000, and Mozambique 6,000. So when we look at the week between January 4th and January 31st, and look at the 4 regions, we see that an overall average decrease of 4% have occurred, and by region, we have recorded a 6% increase in Central Africa, 11% increase in East Africa, 8% decrease in Northern Africa, 7% decrease in Southern Africa, and 22% increase in West Africa. Over the last 4 epidemiological weeks, we have noted the following trends in the most populous countries on the continent. Nigeria has reported an 18% average increase, Ethiopia 13% average increase, Egypt 18% average decrease, DR Congo 3% average increase, South Africa 15% average decrease, and Kenya 4% average increase. In terms of that, Nigeria has reported over the last 4 weeks 11% average increase, Ethiopia 13% average decrease, Egypt 20% average decrease, DR Congo 8% average decrease, South Africa 16% average decrease, and Kenya 41% average decrease. So as of this week, a total of 31 million COVID tests have been conducted on the continent. And the 10 countries that are conducting in excess of 70% of the testing include South Africa, Morocco, Ethiopia, Nigeria, Kenya, Egypt, Zambia, Cameroon, Tunisia, Uganda, Rwanda, and Ghana. And this represents a 3.5% increase over the figures of last week. In terms of capacity, we continue to support member states across the board in the areas of infection prevention control. We had a 40th session of clinical community of practice where we continue to train 130 participants on infection control and managing their infections. Let me just conclude then by giving you an update on vaccines. So the picture on the continent is looking like as follows. Morocco launched its COVID-19 vaccination on the 28th of January after receiving its first shipment of AstraZeneca vaccines. South Africa received its first consignment of 1 million doses of the Oxford AstraZeneca vaccine from the Serum Institute in India on the 1st of February. Algeria on January 10 also received vaccines. Guinea-Conakry received vaccines from January 29, Tunisia on the 30th, and they've all have all registered the Gamaleya Institute the Sputnik vaccine for emergency use authorization. So all three countries, i.e. Algeria, Guinea, and Tunisia. You probably have seen a communique. We've now established our Africa CDC regulatory task force to facilitate emergency approval of vaccines for the continent and provide a pathway for countries to approach us to address issues related to approval of vaccines or for emergency use. With respect to AVAC, that is the African Vaccine Acquisition Task Force or Task Team, on that platform, that is the AMSP, the African Medical Supply Platform, 16 countries have now expressed the interest to place their orders, and that means they've submitted their files with a quotation of what they need for a total of 114 million doses of vaccines from those 16 countries. We are in an aggressive campaign mode to encourage other countries to express their interest through the platform. That way negotiations can start with a financing facilitation from the Afro-Exim Bank. So that is the update I have for you. I look forward to addressing any questions you may have or concerns that may arise. Wayne, back to you.
Thank you very much, John, for that update. And congratulations indeed as we celebrate the 4th anniversary of the formation of the Africa CDC. We have a congratulatory message coming from Lillian Luwaga, and she just wants to say happy anniversary, Africa CDC. Congratulations and thank you for the great work that you are doing. Congratulations. Thank you very much, Lillian, for that. Now, our first question for today is coming from Joe Foster, and Joe is with the German Press Agency. Firstly, when do you anticipate the first delivery of vaccines arriving through AVAT? And a follow-up, many countries in the global north have long started their vaccination campaigns. Why exactly is it taking that much longer for most African countries? She goes on, how are the talks going with China and Russia regarding their vaccines? And finally, do you anticipate that AVAT will also secure those vaccines from China and Russia anytime soon? So that's from Joe Foster, German Press Agency.
So thank you for those series of questions. As you heard me stated, we remember it's just I think 2 weeks ago that we announced the President Ramaphosa announced that we had secured 270 million doses of vaccines, and so that is how we're establishing the process and systems is going on. You heard me mention that 16 countries have expressed interest by submitting their applications, and those discussions will be happening. Our hope is that in the next 2 to 3 weeks, they should be having their vaccines, because this is an emergency. So, but I'll keep you updated, and on, of course, regular basis. It is our priority to make sure that these vaccines are delivered in a timely fashion so that countries can start vaccinating. but I cannot give it a specific date that the vaccines will be arriving. You know, as always, that if once we know that information, you'll be the first to know. Why has Africa not started the vaccines? Well, we haven't started because we didn't have the vaccines. We all know what has characterized the landscape of vaccines in the world, that some countries place a very important pre-market procurement or commitments that made it difficult for vaccines to be available in Africa. So, but that situation is improving. I think we will be, through Outbreak and COVAX, I remain optimistic that in the coming weeks we will start actually rolling out vaccine. I think we celebrate every literary action that occurs on the continents, with South Africa having the first 1 million doses of vaccines. We continue to work with the Serum Institute and Pfizer to get what we can get to start the vaccination. The key thing is to get started, and I remain hopeful that we will get started in the coming weeks, not months. With respect to China and Russian vaccines, again, I want to say this very clearly: we are open to it. Any vaccine manufacturers to discuss with us. I indicated earlier that we have set up our own regulatory mechanism to address the need to quickly advise countries on vaccines, which means we now have an expert committee that can review the dossiers and make a pronouncement and advise on how the vaccines should be used, and based on 2 criteria, which is safety and efficacy. So we now have the dossiers from the Russian manufacturer, and you perhaps saw the results published in the Lancet just this week, showing an efficacy of about 91%. Well, that is very good. We have signed a confidential agreement with them to review the data, and we will be doing that this week. And I think I'm very pleased that, and we have also engaged with other countries, manufacturers, so that they can submit their dossiers to us quickly. That is Johnson & Johnson and Pfizer, AstraZeneca, and Novavax. With respect to China, the China manufacturers, we've written to them through both official channels at the AU and through the vaccine manufacturers to get their vaccine, know more about the vaccines, and also work with them to get their vaccines accessible on the continent. As if you recall, Egypt and Morocco are also going to be using the vaccines from China, and I believe Seychelles is also doing that. So we're offering a platform, a continental platform for regulation, a continental platform to review the data that these companies have produced. We are totally open to working with any vaccine manufacturer on the only 2 conditions: show us your dossier, let's review the safety data and also the efficacy data.
Thank you very much for that. Let's move to our live chat, and we have Mayeni Jones. Good morning, Mayeni.
Hi, morning.
Hi, morning. Just tell us your news organization and then go ahead to the question.
I work for the BBC. I'm their correspondent in Nigeria. My question was regarding fake vaccines. A warning was recently issued by Interpol about the prevalence of some vaccines, fake vaccines already, in countries like Nigeria. What can the CDC and member states of the African Union do, or are already doing, to try and prevent fake vaccines from entering their member states?
So that is a very good question, and it speaks to what I just highlighted earlier, that we've done 2 things. One is there's a clear communique out there that is informing all member states, all collaborators and partners, including the media, that we now have a continental body that can look into those vaccines. I think it's very important that we need your help to make sure that that information is published as extensively as possible, because the one way of preventing those fake vaccines is that everybody is aware that there's a process on the continent, and everybody can say, well, thank you so much for bringing in this vaccine, but look at what the African Union and Africa CDC has put forward in terms of guidance on how to evaluate the vaccines. Have you gone through this process, so that everybody has that understanding? The second thing we have done is produce total guidance, and this is in collaboration with WHO and the AU NEPAD, guidance on how to approach different vaccines. So if someone was to approach country Nigeria, what are your options? So the first thing you ask is, have the vaccine been received emergency approval from WHO? If that is yes, it's a separate category. If the vaccine has received an approval from an authoritative body like the United States FDA, that is a different category. And then if the vaccine has not, then we are here to help you work with them to review the dossiers and advise them. So countries are not helpless. I mean, they have the platform within Africa CDC to do that. And again, those two instruments are on our websites, namely the communique indicating that the whole process of approval, a committee that is in place and a task force for that. Then secondly is the entire guidance document. So I strongly encourage you to help us spread that word out there and use your different outlets to share with member states.
Thank you, John. We have a congratulations message coming from the IOM, and they say sincere acknowledgement of the progressive and successful work done in different areas. To mention one among many, the coordination and technical assistance. We are looking forward to continuing and strengthening our partnership with the Africa CDC to advance the agenda of the health aspect in the context of migration. So that's coming from the IOM. Moving on with our questions, we have a question that's coming in from Lawrence Caramel, and Lawrence is with Le Monde. And he says, how many vaccine doses secured in total? Is it 270 million, or is it 270 million plus 400 million?
It is the latter, 270 million. That was the first announcement. And then after 2 weeks, we had extra negotiations with Serum Institute and secured an additional 400 million doses of vaccines.
Thank you. Paul Adepoju from The Lancet. He has 4 questions. First one, what is the status of COVID-19 vaccine in Nigeria? And what is the Africa CDC doing specifically in Nigeria? The second question, is there an update regarding the oxygen situation? Third question, among the most populous countries in Africa that you mentioned, only Nigeria is recording an increase in deaths over the last 4 weeks. What can you say about this? And then finally, looking back at the Africa CDC's journey, what do you think still needs to be done for the center to be able to achieve its mandate?
So the current situation in Nigeria for vaccine, as far as I know, is that Nigeria is very active in the AVAT platform. Nigeria is one of those countries, 16 countries that have put in their expression of interest in the platform. I think that is very important. We are also aware that Nigeria has a very strong human capacity for R&D in vaccines. But this is not the time to do R&D and to get a vaccine to be used there. I think it's very encouraging that, and we all very supportive of that effort, the efforts that are going on in Nigeria through the local researchers. So the timing, I think that activity will help us prepare for the future. But Nigeria is very active. The Minister of Health Health of Nigeria is part of the AVAC group that discusses. We meet like twice a week to discuss. So I think that we are very working with them. I don't know if the question on what Africa CDC is doing in Nigeria is in the area of vaccines or overall. But overall, I must say that we have worked very, very closely with the Nigeria CDC. And at that point, I really like to recognize the amazing leadership of Dr. Chikwe and the Nigeria CDC in fighting this pandemic. I think we tend to not say it enough, but Nigeria is the most populous country. Without the efforts of the Nigeria CDC, I think that pandemic would have been at a very different place in Nigeria. And we've supported them with rapid responders, with a lot of diagnostics, a lot of personal protective equipment. We are supporting them in the analysis of the new variants. So a lot of work, support has gone into Nigeria from Africa CDC, including, of course, boots on the ground. Let me just say that when the first cases were reported in Nigeria, we had boots on the ground almost the same day from Africa CDC. The deaths in Nigeria, I think death rates are increasing all over the board, not just in Nigeria. I think that is, I mean, not something specific for Nigeria, but it's across the board. Where do we go from here for Africa CDC? 4 years is a very short time in the history of a public health agency. Let me just put it in context. The China CDC was established in 2002, so it's probably about 19 or 20 years old. The United States CDC was established in 1947, so it's probably more than 74 years old. The World Health Organization was established around 1948, so it's almost 75 years old. So these things, they take time. The next, going forward, the key thing for all of us to do is to lay a strong foundation for going forward to support Africa CDC in several areas. I think, in my view, going forward in the next couple of years, Africa CDC will need to focus in workforce development, in public health across the continent, the areas of local manufacturing of diagnostics, vaccines, and therapeutics. A third area of the focus will be really the networking across the continent to be able to harness and use the capacity that exists on the continent already. A lot of capacity exists on the continent, but we need to do what I call knowledge management, bring that expertise all together, and of course, lastly, funding. The first level of funding for Africa CDC must come from member states, and I think that is your own organization. They need to support it, and they have been supporting it, and we are very grateful for all the support. Of course, the partners that are out there, many partners are really supporting Africa CDC, and we are forever indebted to all of them.
Thank you very much. We have two related questions, so I will just bundle them together. The first one is from George Obulutsa, and George is with Reuters News. The question: could you please explain why there is a discrepancy in pricing of vaccines as announced by, say, COVAX and AVAT, and the prices announced by our governments? So that's one, coming from George. Then the related question is coming from Cara Anna with the Associated Press, and she says, why do some African countries have to pay more per vaccine dose than richer countries? And what do you feel about that?
So I think the two questions are related. Our prices for in AVAC are very similar, I hope and believe, to the prices in COVAX. I think that is very clear. And that is where I think we continue to argue and advocate for the whole of Africa approach to coordinate our vaccine efforts. So, for example, if you heard me say that we have 270 million doses of vaccines plus an additional 400 million that we secured from the Serum Institute. That is a large number of vaccines that we are negotiating with the Serum Institute. That gives us a strong bargaining power with the Serum Institute. But if a country will go out of that and do it by themselves and say they just want 1 million doses of vaccines, I'm sure Serum Institute is going to charge them a little bit more. I think that's just the forces of demand and supply. That is it really begs the question as to the need for us to work together in the AVAC process there to get these prices standardized, transparent across the board. I think you all raised very important issues. That is even the underpinning of why the need for AVAC was so important, and we should all rally behind it. We will strongly discourage that differential pricing for vaccines is implemented where countries in the South pay more than countries in the developed world. I think that would be unfortunate because we are dealing with a crisis that is unprecedented, and it is only through this truly a collaborative spirit that we will be able to solve this problem. So differential pricing, especially pricing that favors some other countries and not others, will be unfortunate.
Thank you. We have again a set of questions that are related, and I'm going to take them together. So the first one is from Munyaradzi Makoni, and he's writing from the Lancet. And Munyaradzi says, in the past, you have expressed concern over Tanzania's COVID-19 strategy. What is your comment over its most recent stance on anti-COVID vaccines and vaccination? So that's one. And then the related question is coming from Robbie with Agence France Presse. Robbie says, Tanzania says it currently has no plans to accept COVID-19 vaccines, and President Magufuli has described them as dangerous. Is the Africa CDC concerned about Tanzania's position that it will hamper Africa's efforts to end the pandemic? And what is the Africa CDC's current assessment of the spread of the virus within Tanzania?
So let me start with the last question. And Tanzania stopped reporting its number when they were at, I think, 509 cases of COVID. And that is all we know. Tanzania is a sovereign country. We cannot go into Tanzania and pull out data and bring to Africa CDC. Africa CDC is a creation of all member states, and Tanzania, like other countries, is a very important African member state. The African Union and Africa CDC is their organization. I think I will just continue on that note to call on the Tanzania to work collaboratively in the spirit of the joint continental strategy that we put in place, and that was endorsed by all the African Union member states, which speaks to the fact that we need to coordinate our efforts, collaborate, communicate, and of course cooperate as much as possible. So in the spirit of cooperation, I just want to say this, that Tanzania's stand is a stand that I hope they will review that quickly. This pandemic is dangerous. We truly don't understand and how these things will evolve, but not cooperating with the Africa CDC or the rest of the public health experts in the world will make it challenging for everybody. This is a dangerous virus, a virus that spreads very quickly, and a virus that knows no border. It doesn't know whether you're a Tanzanian or you are a non-Tanzanian. I think it will spread if we continue to not work in a cooperative way. Secondly is that we know what works. We know that public health measures work, and we also know that if we do not get this virus out of our way, the entire continental agendas, i.e., the free trade agreement that we've all committed ourselves to, which truly will be an engine and driver in propelling us out of our current situation of development, will be compromised. So it is for the interest of Tanzania to cooperate, collaborate, and communicate with the Africa CDC and the rest of the world so that we understand what is going on and help. And it is not helpful that we continue to have those challenges with Tanzania. Let me just end by saying that sitting at the heart of Africa Union, which started off as the organization of the OAU, the Organization of African Unity, which was the creation of people like the Julius Nyerere, the Jomo Kenyatta, the Haile Selassie of Africa, and the rest, Kwame Nkrumah. I think they heard dearly in the values of unity, okay, unity. And all of them, when you look at their writings and speeches, they were very committed to the fact that if Africa did not unite, they are bound to doom. And there's nothing that is more true today than the pandemic that we are dealing with. To get rid of this COVID-19 on the continent, we need to go back to the founding words of wisdom of our founding fathers, the Julius Nyerere, and say that what would they do today? I think they will rally around unity, and that is the unity that we need today to get COVID-19 out of our continent.
Thank you for that. I'll take a second question that's coming from Robbie from AFP, and he says, what outcomes, if any, are you expecting from this weekend's African Union Assembly meeting in terms of the continent's response to the pandemic? And also, will you be addressing the heads of state and government?
So there's several outcomes that we are expecting from the head of state's meeting coming up. First of all, it will be the report of the COVID-19 situation will be presented by the chair of the union, His Excellency President Ramaphosa. And we also know that the Executive Council will be presenting to them a decision on financing of vaccines. I mean, and working very closely with the Afro-Exim Bank. I think that decision, we remain very optimistic that it will be addressed and supported so that we at least have a financing vehicle with a political backing to that. I have absolutely no doubt that there will be a strong discussion amongst head of states, a positive discussion on a joint, the need to continue to have a joint continental strategy to fight the second wave and distribute vaccines as much as possible.
Elizabeth Merab from The Nation in Kenya says, will countries need to follow the continental regulations? And what happens if a country, say Kenya, insists on assessing the safety and efficacy of the vaccine on its own? Is it free to do so?
Yeah, I think the answer is yes. I mean, countries are sovereign. We've put in a mechanism to streamline the process so that if a vaccine has been looked at and reviewed at a central level or regional level, say through the East African community or the Southern African community, development community, there should absolutely be no need to keep doing it country by country. It will just slow down the process. But if a country chooses to do that on their own account, that is also very, very appropriate. The key here is to do it right and do it quick.
All right, thank you. Come back. Perhaps we skipped over this one. And he says he'd like to know more about the update on addressing the oxygen shortage in several African countries.
Oh, yeah. I think, Paul, thank you for bringing back that question. I think Africa CDC is working with several partners, especially Total, to try to see how they can use their extensive presence in many African countries to supply oxygen. We've had a series of discussions directly with them and plan to have other discussions. Just yesterday, we received a response back from the French embassy here that we have approached them to use their networks to convene a meeting that we discuss further with the Total in Africa to facilitate that process. We are also in discussions with the World Bank just last week so that we can move in a coordinated way to supporting countries regarding access to COVID-19 needs for oxygen. So a lot of work is going in there because we know that will be, it continues to be a need or an area that requires a considerable effort to begin to reduce the mortality that we are seeing from this second wave.
Thank you for that. We have a question coming from Dr. Fred Molelekwa. And Dr. Fred says, good morning, Dr. John, and congratulations to the Africa CDC for its 4th anniversary. Globally, health workers have been praised for their bravery, their dedication and excellence in managing the COVID-19 pandemic. Now they are in the front line to receive the vaccine, which is highly commendable. However, I am of the view that it would be good if their immediate family members were also put in the first category of the people to be vaccinated to ensure complete state of health of these health workers. Can the Africa CDC use its influence to garner support from the private sector and from individuals to support this idea by making pledges to buy the vaccines for the immediate families of the frontline workers?
That's a very good question or comment, Fred, and we are doing just that. I think this is a very good suggestion that personally I haven't thought of. The family, we were very focused on the healthcare workers, and as you recall, last week we indicated that the MTN had donated $25 million to enable us get vaccines for the healthcare workers, and we also are encouraging the private sector to join the efforts of MTN so that the efforts can be improved. So again, that is a very good suggestion, and quite frankly, I haven't thought about that, and we will factor that into our strategy going forward.
Thank you for that. Elizabeth Merab has come back with another question, and she says, and it is referring to the breakdown of the 16 countries that you mentioned that have put forward their requests for the vaccines. And her question is, which ones are they?
So, Elizabeth, unfortunately, I don't have the list of those countries in front of me. So I just want to be careful that I don't give you names of countries that are not accurate. So, but please be assured that next week we will be able to provide you with the names. And by then, I'm optimistic that the numbers would have increased, and including the number of orders there. So bear with me that I don't have it with me today.
All right, we have a question coming from Katarina Hohi with Bloomberg in Abidjan. What is your view on patent waivers related to COVID-19 vaccines? And would it improve African countries' access to vaccines at more affordable prices if more vaccines could be produced on the continent?
A succinct answer there will be yes. It will definitely help a lot. I think that is, and for more so because we truly don't know a lot about how long these vaccines will protect. I mean, in other words, would the vaccines be protecting for 1 year or 2 years or 3 years? I think that is important. If the vaccines are found to that they protect, but then the protection wanes after 1 year or 2 years, it means that we will be in a repetitive mode to vaccinate over and over, and that will require that we have a continental production of vaccines. So I think that is a very good question. So we believe that intellectual property transfer, the entire discussion with the World Trade Organization, it becomes very valid at this point.
Thank you. Dr. Diana Nsubuga has this question. As we target health workers, how do we ensure that community health workers are also included on these lists?
So keep in mind that we are not just targeting community workers. I mean, that is a start, but nothing says that we have to do it sequentially. It all depends on availability of vaccines. I think the only reason that community health workers will come in front quickly is that they are the people out there fighting for and protecting us. So we need to protect them so that they can protect us. We also know that as the vaccine market opens up, it will be more a question of an aggressive vaccination exercise to reach 60%. I mean, whatever formula we use. I think we know that people with underlying diseases should be prioritized. We know that people, the elderly, should be prioritized. We also, of course, recognize the vital importance of healthcare workers. However, we also want to protect our economies. Okay, for example, if there were vaccines in Ethiopia, I'll make a case for long-distance truck drivers to be vaccinated. The young people that run around and to make the economy work should be vaccinated, because these are the people that are infected, they are symptomatic, but they do transmit the virus. That is what makes COVID-19 prevention extremely difficult, because it is people who are infected and they are symptomatic. It means they become a reservoir, they keep transmitting. The reason that we were able to bring down SARS very quickly was that SARS, those who were infected with the SARS in 2002, they were only transmitting the virus when they were sick. So it became very easy to identify the people who were sick, isolate them, and do stuff with them. But so from that, the pathogenesis and the clinical spectrum of SARS and comparing it to COVID-19, you realize that we need to have a different strategy of prevention, which says, how do we target the reservoir of people that are young, running around and trying to make life made, and vaccinate them as well. So again, there's a whole framework of vaccination that countries will need to embrace to make sure that we scale up, not sequentially, but in a parallel process.
Thank you, John. Lawrence Caramel has come back with a follow-up to the question raised by Elizabeth earlier, and he says, how do you explain that only 16 countries have expressed their interest to get vaccines through the Africa CDC platform? Is it a matter of cost?
No, I think that is very good. In 2 weeks, if we have had that announcement since 2 weeks, and 16 countries are on, and also keep in mind that countries that are getting have placed or a request through the COVAX mechanism, that is the WHO, Gavi, and CEPI mechanism. So we see this as a really good progress. It takes in-country dialogue to happen, and the cabinet discussions to occur before they place their orders. We have sent them all the forms that are necessary, and actually send reminders to all member states. So I remain optimistic. I will not characterize the 16 out of 55 as a low number in 2 weeks.
Thank you for that. We have the questions that are related coming from Silence Mugadzaweta from Newsday. And Silence says, herbal medicine and natural remedies have long been encouraged for use in many African countries. Is there any research that Africa CDC has done to evaluate their effectiveness? And is there scientific data justifying their effectiveness? This was one question, which had two parts to it. Then the second point that he's raising is, what is Africa CDC's position on herbal medicine and natural remedies as cure for COVID-19 complications?
We at Africa CDC are very supportive of any efforts that in the area of traditional medicine or remedy to treat COVID or other infections. We earlier on last year, if you recall, we had a joint meeting with the World Health Organization in Brazzaville to launch a task force that is working on, or a committee that is working on traditional medicine and remedies. So we are very open to that. I mean, we always say is three things: that all traditional medicines should have data that shows safety. Second, it has to show data that speaks to the efficacy. And thirdly, standardization. if we have those three, and there is absolutely no reason why we shouldn't use that. I think we are very open to that. We ourselves are not out there doing investigating those drugs or those remedies, the traditional remedy. That is not what is our immediate need today or a priority today. But if a third party will say, well, we have a remedy here that we believe has an effect on COVID, we will sit down and design a clinical trial, a protocol, and then work with WHO, AFRO, to make sure that the study is done appropriately. And of course, if the results are positive, we will use it or encourage countries to use it.
Thank you, John. Edwin Moyo has written in, and he's asking, how many people on the continent do you expect to vaccinate, and for how long?
We expect to vaccinate at least 60% of our population in 2 years in order to defeat this pandemic. We have to do to be able to win the war against COVID-19, we have to vaccinate quick. And again, this is not something that the continent has done before. That is why we have set up what we call the African Vaccine Delivery Alliance, which is bringing in all kinds of partnerships that will work collaboratively in a coordinated manner to roll out the vaccines speedily. If we do the vaccination quick, then the issues of variants and others will be would no longer be an issue, because that means that the virus is we've denied the virus the ability to transmit. So the short answer to your question is that our goal is to make sure that we vaccinate at least 35 to 40% of our population in 2021, and then in 22 we vaccinate the rest. And again, this will all depend on the efficacy of the vaccines that we are choosing. If we choose a vaccine that has a lower efficacy, then of course that rate, the proportion of people that will need to be vaccinated will definitely increase in order to achieve that community or herd immunity that we've all talked of.
Thank you for that. We have a question coming from Joshua Suleiman, and Joshua says the Nigerian Medical Association has suggested a trial before vaccination. How factual is this assertion? I guess we can also interpret it as saying how possible or how useful is this suggestion?
I would not. Our position at Africa CDC is that if a vaccine has been tested and it has gone through the three phases, that is phase 1, phase 2, and 3, and that it has been pre-approved for emergency use at the World Health Organization or an authoritative agency or the Africa CDC mechanism, and we see absolutely no reason why a country would see a need to conduct another clinical trials of that vaccine to be used. The clinical trials are complex, they are expensive, and you don't do that in the middle of a pandemic like this. You use what works. I mean, I think that is very, very important, that countries work with us very closely and not design new trials for things that are already working.
Okay, thank you very much, Dr. John. We are almost at the end of our allocated time. So I will give you the next few minutes to please round up and sum up the main key headline points that would be the main takeaways from this press briefing today.
No, thank you, Wayne, and of course, colleagues who are on this platform. My first message to all of us on this platform is that we know what works in preventing COVID, the spread of COVID. And we should work together to keep implementing those measures. If you look at countries like Kenya, Ethiopia, and others that have, Morocco, that have bent the curve of the second wave nicely, they are doing that with public health measures. And we backing them up with basic and standardized other control measures. And so I strongly we encourage that we adhere to those, that vaccines are not a magic bullet today. It's not like, well, because 1 million doses of vaccines arrive South Africa on the 1st of February, we should relax, go home, and not do what we know works. And the things that we know that work include continuous hand hygiene, deny the virus space to spread by not gathering in large numbers or even indoor gatherings with people that are not part of a family. You cannot assume that someone who jumped into the household is not infected. Continue to wear masks and wear it consistently. We have to be resilient. If we keep doing those things, then it will build into the vaccine availability and access, and that will give us improve our chances of winning the battle against COVID-19. Second message is absolutely that countries should join the platform, express their interest. The vaccines are there, and without that bulk commitment, it is difficult for us in working through the platform to negotiate for pricing with and even payment with the Afri-Exim Bank. So I think with a strong appeal there for member states to submit their expression of interest through the platform, and they have all the forms, or they just go into the amsp.africa and place their orders or express their intent to get the vaccines. Those will be the two key messages that I really want to leave this briefing today with.
Thank you very much. That was Dr. John, Director of the Africa Centers for Disease Control and Prevention, giving us the general outlook on the COVID-19 situation, as well as taking your questions regarding that issue. He also spoke about the vaccination and the progress that is being made, but also reminded us that we are celebrating here at the African Union the 4th anniversary of the Africa CDC. So, colleagues, I want to thank you very much for having joined us for this press briefing, and also to encourage you as you do your stories to talk about that website that Dr. John mentioned, and that is amsp.africa. amsp.africa. Let's meet again on Thursday next week at the same time, which is 11 a.m. East African time. For now,